says yours would potentially increase coverage for 3 million people, and the efforts of the House and the Senate would cover 30 million. So that's a 27 million person difference. We can have an honest disagreement as to whether we should try to give some help to those 27 million people who don't have coverage. So that's, I think, the last aspect of this, and this is probably going to be the most contentious because there is no doubt that providing those tax credits to families and small businesses cost money. And we do raise revenues in order to pay for that. And it may be that the other side just feels as if, you know what, it's just not worth us doing that. But one of the things I hope we don't do is to pretend that somehow for free we're going to be able to get those 30 million people covered. We're not. If we think it's important as a society to not leave people out, then we're going to have to figure out how to pay for it. If we don't, then we should acknowledge that we're not going to do that. But what we shouldn't do is pretend that we're going to do it and that there's some magic wand to do it without paying for it. So with that, what I'm going to do is I will go to whoever you want first, yep. Mitch.
Mr. President, Dr. John Barrasso is going to make our opening statement on coverage.
And then I will call Henry Waxman. We'll just go back and forth.
Thank you very much.
And because we are short on time, let's keep our remarks relatively brief.
Well, thank you very much, Mr. President. For people who don't know me, I practiced medicine in Casper, Wyoming for 25 years as an orthopedic surgeon taking care of families in Wyoming. I've been the chief of staff of the largest hospital in our state. My wife is a breast cancer survivor. Bobby's been through 3 operations, a couple of bouts of chemotherapy. We've seen this from all the different sides of care. And this discussion needs to be about all Americans because everyone is affected, not just people that don't have insurance. And I've had dozens and dozens of visits to senior centers and town hall meetings and visited at service clubs. And if you go to any community in America and you ask the question, do you believe that this bill up here, that this bill will, if it becomes law, do you believe you will pay more for your health care? You personally, every hand goes up. And then you say, do you believe if this bill becomes law, overall health care and the spending in the country will go up? Every hand goes up. And then you ask the most personal question of all, do you believe if this bill becomes law, the quality of your own personal care will get worse? Every hand goes up. And most worried of all are the seniors when you go to the senior centers, because they know there's going to be $500 billion taken away from those who depend upon Medicare for their health care. And it's not just Medicare Advantage. It's the hospitals, it's the doctors, it's the nursing homes, it's home health, which is a lifeline for people that are home alone. It's hospice for people in their final days of life. That's all going to be cut. That's why the seniors are most concerned. And even the White House own actuary says, if this goes into play, 1 in 5 hospitals, 1 in 5 nursing homes will be operating at a loss in 10 years. That's what we're looking at. Now, for 25 years practicing medicine, I never asked anybody if they were a Republican or a Democrat or an independent, didn't ask if they had insurance or not, took care of everybody. And many, many doctors, I know Dr. Coburn, Dr. Bustani, do that. We take care of everyone, regardless of ability to pay. Doctors work long hours, nurses work long hours. And Mr. President, when you say with catastrophic plans, they don't go for care until later, I say sometimes the people with catastrophic plans are the people that are best consumers of health care and using the way they use their health care dollars. Because a lot of people come in and say, my knee hurts, maybe I should get an MRI, they say, and then they say, well, my insurance cover it? That's the first question. And if I say yes, then they say, okay, let's do it. If I say no, then they say, well, what is it going to cost? And what's it cost ought to be the first question. And that's why sometimes people with catastrophic health plans ask the best questions, shop around, are the best consumers of health care. But to put 15 million more people on Medicaid, a program where many doctors in the country do not see them, as Senator Grassley said, you say, how are you going to help those folks? And Mr. President, When I talk to doctors, I say, I have a way, put all the doctors who take care of Medicaid patients under the Federal Tort Claims Act. That will help them because they're not getting paid enough to see the patients. But if they're Medicare, if they accept those patients and then their liability insurance is covered under the Federal Tort Claims Act, I think